tract infection or tract infections. Let's check the introductions for urinary tract infections. Before going to urinary tract infections, we will know what is the urinary systems. Urinary systems is we can divide it into two types, which consist the upper urinary tract and lower urinary tract. Upper urinary tract, which can consist kidney and ureter, and the lower urinary tract, which is consist of bladder and urethra. This is about the urinary tract, urinary system. What happens in urinary tract infections? The infection caused by microorganisms in the urinary system are termed as urinary tract infections. That means when any microorganisms that can cause the infection to the urinary tract, that is termed as urinary tract infection. That means when any microorganisms can affect this system, this urinary system, it is called urinary tract infection. That can be upper urinary tract or lower urinary tract. What happens when the upper urinary tract is infected? That means kidney and urethra get infected. That is known as kidney infections or pyelonephritis. And when the lower urinary tract is infected, is known as bladder infections or cystitis. Urinary tract is the second most common disorder which occur at all ages. Urinary tract infections are occur at all age group and in both sexes, male or female. But the women are more prone to UTI as compared to men. That means women having the more risk for UTI as compared to men. That is because of their anatomy and physiology of urinary systems of women. Let's check the etiology. Etiology of urinary tract infections are bacteria, viral, and fungal. In bacteria, there is E. coli can cause 80 to 85% of urinary tract infection can cause due to the E. coli, and rarely the viral and fungal can cause the urinary tract infections. Most of the urinary tract infection can be caused by bacteria, and these are the some examples of microorganisms or positive organisms which can cause the urinary tract infection. There is the other risk factor. Other risk factor means which can increase the risk for urinary tract infections. These are the anatomy and physiology of women organs, that is the urinary systems, urinary catheters, that if we use urinary catheter unhygienically, that can cause the urinary tract infections, or that can increase the risk for urinary tract infections in children due to the vesico-urethral reflux. That means the decrease the abnormal flow of urine on the catheter backwards, and hyperplasia that can cause the obstructions of urethra, and the diabetes that can increase the risk for urinary tract infection. Let's check the pathogenesis for urinary tract infections. Means how the urinary tract infection can cause. In the bowel, we know that the bowel is the most predominant site from where the microorganism enter to the urinary tract. Means from the bowel or through the bowel, the urinary tract infection through the bowel, the pathogenesis are entered into the microorganisms are entered into the pre-urethral area, and they are get colonized. Colonizations of pathogens are occurs, and after that they are sent to the bladder through the urethra. Through the urethra, they are sent to the bladder, and their epithelium penetration is uroepithelium penetration is occurred. In this, what happens? The fimbria allow the bladder epithelial cell attach and penetations, and after that, what happens? The following penetations, the bacteria continue to replicate it, and they forms the biofilms. After they form the biofilms and they get penetrations, they are ascensions is occurred. In that, what happened? Ascension is occurred due to the fimbria, and in this, once the sufficient bacteria is colonizations occurs, the bacteria may ascend to the urethra to the kidney. After the sufficient bacterial colonization occur, the bacteria are ascend to the kidney, and they can cause the polynephritis. And in this also what happened, the bacterial toxin, what they happen, they can reduce the urine flow. And after what happened, polynephritis means what, the infections of renal parenchyma cause an inflammatory response called polynephritis. When the kidney, the due to the inflammatory response, what happened, the parenchymal cell is get infected, that is called polynephritis. And while the infections of renal parenchyma is occurred, as the result, the bacterial ascension, and it can also occur from the hematogenous spread. The polynephritis or parenchymal infection, renal parenchymal infection can also occur from the hematogenous spread. And after the polynephritis occur, that what happened, if the tubular obstruction, if the inflammation are continuous and the tubular obstruction and damage is occur, that is increase the interstitial edema, and after that, that is interstitial nephritis can occur, and that can cause the acute kidney injury. That means in urinary tract infection, what happens? First, the colonizations is occurred, and after that, the uroepithelium penetrations is occurred, and then ascensions is occurred. They are sufficient. In this, what happens? The sufficient amount of bacteria get colonized, and they are ascend to the kidney, and after that, the polynephritis or infections of a kidney is occurred. And if the kidney it is untreated, or it is for long period of infection, can long period of time, that can cause the acute kidney injury. Let's check the signs and symptoms for urinary tract infections. The first is the most common signs and symptoms for lower urinary tract infections are burning while urinations and feeling of urination. That is an urge to urinate in the absence of vaginal discharge and significant pain. The symptoms may vary from mild to severe and last for around 6 days. It can present for 6 days, and there may be some pain above the pubic bone and in the lower back. Next, in case of upper urinary infections, the symptoms are pain, fever, or nausea and vomiting. In addition to classic symptoms of lower urinary, that means the lower urinary tract infection, which symptoms are present in lower, they are present, and in the additions with them, the pain, fever, nausea, and vomiting can also occur. And rarely we can say the bloody or contain visible pus. In case of young child, the symptoms are poor feeding, vomiting, more sleep, or symptoms of jaundice may also observed. In older children, urinary incontinency, that is a loss of bladder control, may occur. In elderly people, the common symptoms are lacking, fatigue, change in mental status, and incontinency is usually observed. The complications of urinary tract infections are like recurrent infections. That means urinary tract infection can cause repeatedly or occur repeatedly. That is especially in women who experience 3 or more UTI, permanent kidney damage due to polynephritis, or untreated UTI, increased risks in pregnant women of delivery, low birth weight, or premature infants. That means the women have delivered the premature infants, and urethral narrowing in men from the recurrent urethritis, and sepsis that can cause life-threatening complications, or that can be life-threatening complication, especially if the infection spreads to the kidney. These are the some complications of our urinary tract infections. Thank you for watching.